For as long as she can remember, Nancy Viney wanted to be a nurse. She has worked in a range of clinical areas and communities, joining Northern Health in 1997, but it was her transfer to public health in 2000 that led her on the most significant chapter of her career.
Ever since I graduated from nursing, I saw the devastating effects of tobacco on families, individuals, children, where people lived shorter lives, lived with diseases, and were exposed to secondhand smoke. Many children grew up in homes of smokers and learned the behavior and started again when they became teenagers.
In 2008, Nancy took on her current position of Regional Nursing Lead, Tobacco Reduction for Northern Health. In northern BC communities, smoking rates trend about 10% above the provincial average, but rather than get discouraged, Nancy saw this as a rallying cry. Her work is grounded in the belief that everyone has a role to play in creating smoke-free communities, and as a passionate advocate, her grassroots marketing approach is impossible to ignore. Nancy was instrumental in getting the 2015 Winter Games in Prince George declared 100% smoke-free, and played a critical role in drafting Prince George's new smoke-free places bylaw.
Nancy provides services across a region the size of France in more than 24 communities. She brings awareness about smoking and how to quit. She works with our physicians and our health service administrators in terms of how do we prevent people from smoking before surgery and support them on our smoke-free grounds. And she covers a lot of miles when she does that across the region.
She routinely makes herself available outside work hours to support and lead community events, and led the development of a revised smoke-free grounds policy and clinical practice standards for all Northern Health clinics. Nancy is passionate about tobacco reduction, but her approach is also respectful and inclusive, recognizing that natural tobacco has been an integral part of Indigenous cultures in BC for thousands of years and is not the same as smoking or chewing commercially produced tobacco.
I really like my job, and I really feel that we can make a difference within Northern Health. We have very high smoking rates here, and I think if we do a really good job at creating environments to support people to live tobacco-free and help people quit, we can lower our rates here and have a healthier Northern Health population.
Nancy's an exceptional selection for this award. She goes above and beyond in everything that she does.
Nancy, for your relentless dedication to improving the lives of Northerners through reducing tobacco use, you are this year's Healthcare Hero for Northern Health, generously sponsored by Pacific Blue Cross.